Welcome to Heart-Based Medicine's Insights podcast, featuring Anat Baniel, clinical psychologist and founder of the Anat Baniel method, NeuroMovement. What is heart-based medicine?
Well, for me, heart-based medicine really looks to move the amazing field of medicine, as we have it already in the Western world, to move it to a whole fuller and more advanced dimension. The whole dimension of the experience the patient is having while they're being treated, while they're getting this incredible surgery, transplant, chemotherapy, anything that is there to help them stay alive and thrive. That part is missing, and that part has a huge impact on the outcome of the intervention. So in the beginning, in the childhood of the medical field, the discoveries and the fascination with the power of medical intervention was such that the patient became almost like an object, and not maliciously. It's just the focus was on what was believed to be the reason for the success. And it is true that a lot of the success has to do with the intervention. What has been left out is the enormous impact of the experience of the patient while they are getting the intervention in the final outcome of that intervention. So heart-based medicine is the opportunity to intentionally begin bringing different aspects of the experience of the patient and how we interact with the patient in relation to that experience to potentiate the outcomes further and further. And another way of looking at it is that we are bringing more of the person into the consideration of the more direct traditional medical intervention. I think that what medicine can do is beyond remarkable. I would not want to live in a world where it didn't exist. The innovations every day are amazing, and there is more and more awareness that how you talk to the patient or whether you're friendly to the patient or not can also make a difference. But there is a much bigger conversation that can bring the holistic approach. And my angle is the angle of a thinking in terms of the brain and neuroplasticity, and how the way you interact and connect or not connect to your patient actually impacts what the brain is doing. And that the hidden secret is the enormous impact of a positive brain change or negative, reactions by the brain on the actual healing process. So it all becomes the science, the medical skillfulness, and the emotional, behavioral, internal feeling world of the patient become all one system that we address in different ways.
How can this new paradigm positively impact on medical practitioners?
Well, I know what I do, which I call, Anat Baniel method, NeuroMovement. And for my work, I'm not a medical doctor. However, I work with a lot of people that consume a lot of medical attention, including small children with special needs and sometimes very severe conditions. And I have, over the years, done what I do and have seen outcomes that are really outside of what was considered even possible. So I looked at what it is that I was doing. I knew I was impacting their brain, because when a child learns to do something they couldn't do, when a musician can play in a different way that the pain disappears, or so on and so forth, I know that the brain had to change for that to occur, because the brain controls the movement, the brain controls how the child is thinking, moving, talking, what they can do, what they can't do. So that part was the baseline for me. But I asked, what I'm doing that drives such dramatic changes? And I came and defined 9 essentials. And I'm going to list them very briefly here. And what happens is when I or we apply the essential, it gets us better. And they're not time consuming. They just require awareness of them and the choice to act in a way that abides by the essentials. So the first one is movement with attention. So let's say you're going to perform surgery, open heart surgery. Oh my God, I mean, I don't think I'd ever have a courage to do that, right? You're going to move. You know, you're going to move your arms. You're going to do actions. The people around you are going to do the same. You can move, and just a few seconds at a time, just go inside and say, how does my arm feel? Oh, if I move my elbow a little lower, my shoulder will be a little less tense. Just like that. And then you just go focus on what you're doing. And then you rerun it at a certain moment. Maybe you feel a little bit tight or something. And you pay attention to how you move. Your brain wakes up and is like alert and ready to create new connections. That means it brings you into very creative mode. You can do the same thing if you're in the gym and you're on the treadmill. You can slow it down a bit, and you can pay attention to how you feel when you move. And you do that for a minute or two. You go back to the previous speed, you'll see that you're moving a lot better, because the brain is built to always look to optimize our function. If you didn't do that, none of us would survive. None of us would learn. Obviously, the brain selects which connections and which patterns to use. And my understanding and belief is that it always looks to optimize the best it can at any given moment. So that's the first essential. The other one, slowing down allows us to feel what's going on and lets the brain operate at a much higher level. I won't go into all the information system and theory and all that stuff. But slowing down, it's not a big slowing down, because you have to do what you do. It's almost like a feeling slowing down. And if you finish doing the stitch 4 seconds later or earlier, unless, again, it's a life and death situation, that's kind of slowing down. Is not going to make a difference. If you have a patient in your office and you talk to them and you just take a deep breath and you give them you slow them down because they think you're in a rush and they try to tell you everything fast. You say, it's okay, I can give those extra 2 minutes. Tell me what it is. You don't go to chit chat, you don't waste your time, but you slow down the process. Everybody gets elevated. The whole hormonal mechanisms work better. And not just your patient is better, you're better. You're happier. The other one is variation. It's like you do things and it becomes very routine. Some things have to be routine or it endangers the patient. But wherever you can do something in a different room, decide to open your conversation in a different way, it awakens up the brain, it wakes up the vitality of the system. Enthusiasm, when you're working with a patient and they look to recover, that you have the understanding that if you amplify the small changes, they will heal. And you say, look yesterday we were like this, today you're like that. You have a really body that can heal. The outcome of the healing can completely take a new trajectory of a much better one. So these are just 4 of the 9 essentials. And if doctors just took that, they will do better, not just their patients. It's more than just self-preservation. It's just the quality of the ongoing experience, and that the experience is more enlivening one, because the stress is intense. I said, I don't think I could ever be a surgeon. I don't have it in me. I can do what I do well, but I don't. Or it's not just a surgeon. You can, if you're a general practitioner. I have a wonderful doctor. I've started with her when she just finished medical school. I've been with her for a long time. And she has to deal. I have a friend that I sent her who is now battling very, very serious cancer, and she was the one that figured out something is really, really wrong. So it's a life. It's truly life and death profession. And in the meanwhile, there's a way to make it, to do it that makes it a much, much better experience for the practitioner, for the doctor.
What kinds of resistance to this approach have you encountered?
Well, I want to say, first of all, on the positive side, there's a whole lot more interest. The guy who's the head of the Association for all of the children's hospitals in the United States is very interested, but he's aware of the challenges. First of all, it's different and it's new. And anything that's really new or different, it meets resistance throughout the history of the development of knowledge. I mean, this is to be expected. And if you understand how the brain works in a way that basically says, it worked up until now, I'm not going to change. I'm going to stay with my habits. It's reliable. I'm alive today, all these days, I'm not going to change. So that's built into the system. If you understand, the plasticity of the brain goes both ways, creating the new and grooving in more deeply the existing. And of course, aging has so much of the grooving in and not enough of the new, and that's a lot of why we age the way we do when we age this way. So there's the general human expected resistance to change, which is biologically built into us. So nobody's doing anything wrong. There has been a big movement into but in sort of unrelated islands, understanding that brain change is a reality throughout life, and now in the medical world, more and more realizing that you could intentionally activate brain change in certain ways, in certain directions, to get outcomes in certain ways that are as good or better than traditional medical intervention. You can certainly enhance, like I was talking, the outcomes. At the same time, it's very different. It's really different. And it requires giving value and importance to what we feel, to the subjective world. And that feels really dangerous. That feels like, no, we've got to keep it clean, and we don't want people to be emotional, and we don't this, and we don't want that. And the information that comes to us from our feelings is the basis for everything. It's the basis, that combined with movement, that's the basis for all learning, for the formation, the structuring of the brain and so on. So this is very, very foreign. And how does me, cutting up a patient has to do with how they felt before or after? I mean, give me a break. I mean, I just have to do, and I don't have time for it. And so on. And it's it's a major, major cultural shift. We just came back yesterday night from working in a school district up in Canada, 2 schools, where we're implementing our movement work and the essentials, grade 2 to 7. 300 children got, 2 times a day, 15-minute movement lesson. Anyway, the changes in the kids are remarkable, and the aides and the teachers see it, but they go like, how do I do this? How do I do this? Because they have to change themselves. They have to become aware. Am I moving fast or slow? Am I anxious? Am I trying to make the child do something before they are ready because I want to perform well as a teacher? There's a huge personal development that goes with it. Evolution, a personal evolution. So we're calling upon everybody to evolve to some more. I mean, I don't think that what I say is the final thing by any means, but it's one of the steps we can take. So that's, I think, is the resistance, and I think it's going to happen more and more. Of course, any change is risk. Any change is risk. I mean, I tell my students, change sucks. Except the right kind of change can make your life better, I mean, who wants to change? When you get used to changing, it actually becomes hard not to change because it feels very, it's kind of like slowly turning down the lights inside oneself. But it's not compulsive change. It's just openness to curiosity, to, let me try this. Discovering when I'm defensive, saying, do I need to be defensive? Can I maybe allow it to go and see maybe there's something here for me? I find myself resisting change continuously. I mean, it's not that I never change, but repeatedly, not continuously, but repeatedly. Of course. I mean, give me a different hotel room. I like the one before, It's like, of course. But when it's known it has to be done in a way that is safe. Change has to be presented safe. So again, coming back to the school example, that I told the school it has to be a whole system change. So I need to work with the aides, the teachers, the principals, the children, everybody, because they brought us primarily for children with special needs, which now it's like an epidemic and it's very, very difficult. I said, I'll do that provided we do it generally. And they said yes, and the woman in charge of all the programming she said they're all wonderful. I mean, it's amazing to work with them. They've taken a big risk bringing us in. And she said, I said yes to working with all the classes. She said, and I had no idea what I said yes to. Because it's a sea of change, right? So, but if that's cool, if we could, I mean, we are going to continue, we're doing it this whole school year. And if we get really good outcomes, we're doing research in collaboration with a Harvard Medical School doctor, and we're doing research and collaborating with somebody she's a neuroscientist and a computer, because we're going to use sensors to measure changes in the brain, and she's in Rutgers, and if the whole thing ends up being effective and successful, there are already other schools that are asking us to come, and we go like, we don't know what we're doing, we can't offer you anything. So we have to see, but the interest is because of the need.
This has been a Heart-Based Medicine production. Thanks for listening.